Oxygen therapy has been used in hospitals for generations to treat serious medical conditions, but now healthy people are using it as oxygen Red Bull, so to speak, in order to get supercharged for the week.
Could it hurt? I don't know. Joining us on the KOGO News Live line, Dr. Al Johnson from the Hyperbaric Centers of Texas. And what does hyperbaric oxygen therapy involve?
Well, it involves breathing 100% oxygen in a pressurized chamber, which then the oxygen is saturated, or the blood vessels are saturated with oxygen. That's not only the hemoglobin, which normally carries oxygen, but the plasma. And that delivers about 10 times the amount of oxygen to the cells, which helps stimulate the cell function. Cells need glucose and oxygen, and cells that aren't functioning 100% then are stimulated and can produce then the ATP from their mitochondria in a greater manner to have beneficial effects on how you feel.
So is there any type of risk involved in this?
No, there's minimal risk. It's an off-label use of hyperbaric. Hyperbaric's been used by athletes for years to help recover from exercise, to help in high-altitude activities such as biking. And it's been used off-label to treat autism, cerebral palsy. Europe, they use it for strokes frequently. And in the article you're referring to, I have some attorneys that use it to help clear their brain, help them to think better, and to give them better energy for the coming week. And so they take a treatment on Saturdays and use it to feel better the rest of the week.
So the effects last that long?
Well, it clears. What it does is it helps clear the body. So when you're under pressure, it gets oxygen to the tissues. It helps the lymph flow because it compresses your tissues. And with that, then you feel better over a period of time. So the oxygen only stays around for maybe an hour or two afterwards at any increased amounts. But the effects of it are longer lasting.
Michael Jackson did this, right, with the hyperbaric chamber?
He did. And he used it because of all his plastic surgery and that to help heal faster, keep the swelling down, and maintain vitality.
Huh. All right. So is there any danger to people, or are there any people who should not take part in any kind of a hyperbaric thing?
The answer is yes. People that have had collapsed lungs, they have to be very careful. And it needs to be supervised by a physician, so you need to have a physician supervise it. But the biggest thing, it's like scuba diving. So the biggest thing is clearing your ears, making sure you can clear your ears with the increase in pressure. Otherwise, it's really quite safe, done under supervised conditions.
All right. Thank you very much, Doctor. That's Dr. Al Johnson from the Hyperbaric Centers of Texas.